All right, Dr. Wise, we're good to go. Let's dive in.
Awesome. Welcome, everyone. Thank you so much for having me. I'm excited to be here for the first time with the Lupus LA community. My name is Dr. Leanna Wise, and I work here at the University of Southern California. I work at the Keck Medical Center and also on the county side, now called Los Angeles General Medical Center, formerly LAC USC. But I trained here as an internal medicine resident and as a rheumatology fellow, and now I am here as a faculty member. And I'm very excited to talk with you guys today about lupus and hormones, which is a very, very big topic. Lots to talk about. When I was speaking with the folks here at Lupus LA, they sent me some questions, which is really helpful. And before we dive in, I do want to just say a few things first. First of all, as I'm sure all you know, lupus is a very diverse disease. So what I say here, these are big blanket statements. I'm not your doctor. I am a doctor, but I am not your doctor. So anything I say here, please take this to your rheumatologist. I am not saying this to treat a certain individual. These are just kind of big blanket statements. This is general rheumatology lupus knowledge. I don't want to make a specific recommendation to whoever's listening, whether you're a patient or a loved one or a friend of a patient. Anything I say here, please take it to your own rheumatologist or your own treating physician. I am not going to be providing medical knowledge to a certain individual for you to treat a certain individual. Again, please, anything you hear me talk about, lupus is a very diverse, we call it heterogeneous. It can look very different from person to person. Whatever I say here, again, please bring to your own doctor. And just that being said, given how different each lupus patient is, not everything I say here will mean the same thing for every patient. We're talking about, people in general are quite different. And then lupus is a disease that is on the more rare side. And then people just being who they are, it can look different from person to person. So just want to put that disclaimer out. Yeah, lupus and hormones. So it looks like here we have some questions submitted beforehand. So let me bring those up. Just to preface this, just for a little background, I think as most of us know here, lupus is a disease that predominantly affects women. I didn't prepare a PowerPoint. We could maybe talk about a PowerPoint another day when we maybe do a little more something formal, but I think this is pretty common knowledge. Lupus is mostly a disease of women, but some men are affected with lupus. 90% of lupus patients, though, are females. And this makes us think that, well, that being said, estrogen, a female hormone, is probably involved in the pathogenesis or the beginning of lupus. If most people with lupus are women, probably female hormones are involved in lupus or play some sort of role in lupus. So it's very natural to have questions. Well, how do hormones play a role in lupus starting? Does lupus affect hormones? Can I take birth control? What does it mean if I want to get pregnant? What does it mean if I want to, do IVF? What happens when I go through menopause, et cetera? So it's very good to discuss these questions. So let me go ahead and try to bring these up. All right, lots of questions here. I'm going to actually start off with one of the most kind of straightforward questions. Does lupus mess with your hormones? This is a really good question. I think this could kind of mean a lot of things. What does it mean to mess with your hormones? We have hormones of many types throughout our bodies. We have thyroid hormones. We have what could be considered sex hormones like testosterone and estrogen. I'm going to answer this question from kind of the perspective of sex hormones. So specifically from like an estrogen and progesterone standpoint, and these are the hormones that play a role in our menstrual cycles. So I'm answering this like as it relates to female sex hormones. Again, these are the hormones that help us ovulate, make eggs, and have periods. So can lupus mess with these hormones? Yes, they can, is the short answer. The longer and slightly more complicated answer is that any chronic disease that causes you to be stressed can mess with your hormones. Even just stress in general can mess with your hormones. If you are under an extreme period of stress, even without having a physical chronic disease, if you're under severe stress for a long period of time, you can actually skip your period. Your body will say, hey, let's conserve energy. We're not going to have a period this month. We're not going to go through the cycle of making an egg and having the uterus build up the lining and then cause bleeding and have a period. You can actually mentally, without even really realizing what's happening, you can actually shut down your menstrual cycle and not have a period. If you take that a step further, and if you have a disease like lupus or another autoimmune disease, inflammatory bowel disease, rheumatoid arthritis, cancer, any kind of chronic disease where you have a lot of inflammation for a long period of time, you lose a substantial amount of weight, or something happens that's particularly stressful, this can mess with your hormones and you can lose the ability to ovulate and have a period. So a lot of my lupus patients will note that maybe in the months leading up to their lupus diagnosis or the months after their lupus diagnosis, especially before their lupus gets under control, their menstrual cycles were really off. Maybe they were quite regular before they were diagnosed, but then their menstrual cycles started to kind of come and go. They would go, maybe 14 days in between periods and then a couple months in between periods. This is really, really normal. And again, not specific to lupus. We can just see this in any chronic disease and anyone who's under a severe amount of stress. Lupus is a very stressful disease to have. There's lots of inflammation. And so this is very expected. So it's not something that's specific to lupus, but it can happen. And then vice versa. We know that just, again, having female sex hormones is implicated or is involved in having lupus to begin with. So yes, lupus can mess with your hormones. Now, on the flip side, lupus does not necessarily make you infertile, though. So patients will also ask, well, because I have lupus, am I not able to have children because of the disease itself? And generally, from what we see from the scientific studies, is that lupus itself does not cause you to be unable to have children, with a few key exceptions. One, if you have a component of lupus called antiphospholipid syndrome, this is when you produce blood clots, unfortunately, and these blood clots keep you from having a successful pregnancy. So if you have this component of lupus, this is very unfortunate, but you don't actually have a decrease in your ability to make eggs. Your actual ability to make eggs is preserved and fine, but the ability to keep a successful pregnancy is compromised because of the blood clots. And then two, the other situation is if you get a certain medication called cyclophosphamide, that does decrease your ability to make healthy eggs. So that aside, when people ask this question, does lupus affect my ability to have healthy hormones and produce eggs so that I can have children? Generally speaking, the answer is actually no. You should be able to produce eggs. Again, with the exception, though, if you're super stressed and your body has shut down the menstrual cycle, that can affect it. But no more so than, say, severe stress from another disease or severe stress from even persistent ongoing anxiety or depression. But it's not something that's inherent to lupus itself. Some subtleties there, though, in that question. So it's a little more complex, not a straight black or white answer. All right, let's see if we can get another question up here. I'm going to try to hit a couple questions here all at once. People are asking a lot of questions about lowering estrogen. Can they take estrogen? What about IVF? Things like that. Should they take estrogen? Can they try IVF? We'll try to wrap up a couple questions here. People ask, can they try IVF? Should they lower estrogen? We're going to talk about a couple of things here. Basically, what happens, or could someone try something like IVF, which is in vitro fertilization? So anytime we talk about adding extra hormones in lupus, what could happen? So again, I'm going to try to answer a couple questions here all at once. There's several questions asking about the safety of using extra hormones. So this could be in vitro fertilization, when someone has pregnancy helped out by extra hormones, what we call exogenous. Exogenous meaning you take extra hormones in order to get pregnant. And some people also asked about hormone replacement therapy. So when you go through menopause, you take extra hormones to decrease some of the menopause symptoms. These two situations are very, very, very individualized to the lupus patient. And as I already discussed at the beginning, one size does not fit all. And I will also say there's no free lunch. So I can't make a blanket statement for anyone or for everyone. But what I would say is anytime we add extra estrogen to anyone, we have to be aware of a couple things. An increased risk of blood clots, which lupus patients can already have a higher risk for, and an increased risk of a lupus flare when we're adding extra estrogen. And so when I have a patient come in, let's say I have, just say a hypothetical patient, Mary comes in, she wants to know, can I take extra estrogen because I want to get pregnant through IVF? I want to know two things. Is her lupus well controlled? If her lupus is pretty active, even medium active, moderately active, we would say, definitely if it's severely active, I would say no. I do not want her to take any extra estrogen if her lupus is not quiet, in remission, or at least very, very close to being in remission. I do not want any extra estrogen on top of what's already going on. Or if she has a history of having a blood clot or having risk factors for a blood clot, which again is this nasty component of lupus called antiphospholipid syndrome. You'll hear me mention this probably a couple more times. Again, antiphospholipid syndrome is a predisposition to blood clots. And I'm sure in the Lupus LA community, this has already been discussed probably before, but this is a component of lupus that predisposes you to having a blood clot. So if somebody already has a history of a blood clot, or the markers for a blood clot, or has active lupus or even moderately active lupus, I do not want them to take any extra estrogen. So this would be IVF, this would be hormone replacement therapy, or even combined oral contraceptive pills. So if someone says, I need to do any of these three things, again, oral contraceptive pills, so, just your classic everyday birth control pill, IVF treatment, or hormone replacement therapy, I would have to say no. Again, going back to what I said at the beginning, definitely be discussing these things with your rheumatologist. Even if you said, well, hey, I'm in remission, I don't have any antiphospholipid syndrome, these got to be safe for me, I would not say go for it without discussing it first with your rheumatologist. Again, we want to be very, very safe with, once you're in remission, the last thing we want is for you to go out of remission or to have some sort of horrible new problem because of a new medication we're taking, like extra estrogen or something like that. Okay, let's see what else we have here. We have along the same lines, let's see what else. Are there any, this is a good one. Are there any supplements that help balance hormones that are safe for lupus patients? This is a great question. And I want to be careful about this because this one, again, you have to discuss this with your rheumatologist, but the answer to this is yes. Are there any supplements that can help balance hormones that are safe for lupus patients? Something that I'm a big fan of is actually not taking supplements. I'm a big fan of overall very healthy eating. Lots of fruits, veggies, fish, nuts, overall what I would call Mediterranean diet. But if you're going to discuss a supplement, there are over-the-counter supplements that many people do research and they do look at in their spare time. So I know that my patients are looking at this, and I've had patients ask about this. There's one called DHEA, and I do recommend that if patients explore this, that they bring it up with their rheumatologist. So again, I'm not making a recommendation for this by any means. This is something that you can bring up to your physician, your rheumatologist, but again, it's called DHEA. And it is a low dose male hormone, actually. Like I said, though, there's no free lunch. There was a study in which patients took this and some of their lupus did get better, but one of the side effects was acne. And I think some other issue, I can't remember some of the other issues, but it's like, well, some issues get better and now all of a sudden you're getting more acne. So you also have to balance the risk of having more heart disease. Anytime someone takes extra male hormones, there's always a higher risk of having more heart disease and lower good cholesterol. And that was also seen in some of these studies. So just because something might be good on the one end, even when people say, well, it's just a supplement, I bought it at Whole Foods or I bought it at Costco, just because you can buy something over the counter does not mean that it's necessarily safe. So again, this is something that if someone's interested, they can always bring up to their rheumatologist and say, would this be good for me as an individual lupus patient? But yes, there are some studies that show that this DHEA supplement may help to control lupus in some situations and kind of balance the hormonal issues that we see in lupus. I don't recommend it across the board to all of my patients, but if a patient is interested in it, I do kind of have a risk and benefits discussion with them. Let's see what else we have here. This is a good one about testosterone in males, and I'll actually discuss it with females too. So someone asked, what about lupus in males? Even though lupus does not happen frequently in males, if we treat them with testosterone, would it improve? So I'm going to extend that a little further. If we treated females with lupus with testosterone, would it improve also? If it's a disease that might respond to testosterone, what happens when we treat patients with lupus with testosterone? Given that it's such a female disease, maybe it would improve. Unfortunately, we don't really see that in the clinical studies, both with females and males. When we actually give them testosterone patches, both for females and males, we really did not see much in the way of improvement. So not really the answer, just slapping on a testosterone patch. I wish it were that easy, but with lupus, it's pretty complex. Treating versus preventing are very different things. So perhaps getting ahead of the game and figuring out how to prevent lupus in someone who might be really at risk, maybe someone whose mother or whose sister has lupus, it may look different than someone who has really preventing the lupus in that patient. It may look very different than in someone who has active lupus. So a lot of the studies that we're looking at from the past 10 or 20 years, they're in active lupus patients. These are all very good questions that might look very different as we try to prevent lupus in the next 10 to 20 years. And it's kind of a subtle issue, but it'll be interesting to see what happens as we try to get more into the realm of preventing or treating mild lupus rather than trying to treat really severe and difficult or advanced lupus. But unfortunately, no, testosterone does not, just giving testosterone does not improve lupus. Oh, this is a really good question. Are there certain parts of your cycle, I'm guessing menstrual cycle, that have higher hormones that can cause flares over other times in the cycle? So there were some studies, one study in particular where scientists looked at the correlation between the menstrual cycle and lupus flares. It didn't really pan out that there's a very clear correlation between different times of the menstrual cycle and lupus activity. So basically, patients who had lupus flares, it wasn't always at one certain part of the cycle, but not surprisingly, a lot of patients with lupus flares did have PMS symptoms. So lupus patients are not immune to PMS symptoms. We all get PMS symptoms, I would say, probably most of the general female population to some degree. Lupus patients also get them, and they did have worse PMS symptoms compared to healthy controls or women who did not have lupus, but they were not necessarily getting flares at certain times. In my practice with my patients with lupus, I do feel that some of them are very good, though, at noting that their lupus does seem more active at certain times of the cycle, but that seems to be very different from patient to patient. So it's not like across the board, it's the same time for all the patients. So some of these patients will take a little more ibuprofen at a certain time. I have a single patient who takes a little extra steroid at that time. And I have one patient who, from her OB-GYN, she actually is on birth control and she takes her birth control pills and skips her placebo week. And I think this is just a testament to the fact that these patients are very different. There is no one size fits all of this is your medication regimen and it's going to work for everyone. And the answer for treating lupus is going to be the same for every single lupus patient across the board. I mean, just female reproductive health and female hormones are different from woman to woman. So imagine you're taking this somewhat rare disease that differs from person to person and now add that and make that even more complex. So Again, yes, there can be some variability based on the menstrual cycle, but it's not a clear correlation and is definitely not for all women across the board. All right, let's see if we can get a few more questions here. We have a few more minutes. Here's a couple good questions on menopause that I'll try to put into one. What can be done now to start preparing for menopause with lupus, change in diets or supplements, and what can someone with lupus expect menopause to be like? Is it worse for us? I don't actually expect that it could be worse than a patient without lupus. Generally, we expect lupus to improve with menopause. So if anything, I mean, could be a relief, I would say, but I don't actually expect menopause itself to be worse. I'm not aware of data that shows that it would be any worse. Now, that being said, there is some data that shows that lupus patients might have more PMS symptoms. So maybe they do have some more hormonal fluctuations around that time, but I don't think there's any reason to really think that it would necessarily be worse over that perimenopause time. And again, if anything, kind of knowing the natural history and the natural progression of lupus, if anything, there's a potential sense of relief as the estrogen levels start to improve around or lower around the time of menopause. So I don't think it will be worse. And then what can be done now to start preparing for menopause with lupus, change in diet or supplements? I'm not a huge supplement fan. I'm a really big fan of healthy diet. There are some decent studies on diet and lupus, and maybe that would be a live session for another time, but diet and lupus can go a really long way. Women, even without lupus, as they go through menopause, can have a variety of symptoms, some including weight gain. So I am a big fan of making sure that women are actually eating very good protein during this time and not trying to diet, actually not making sure that they're not restricting healthy protein. So this would making sure that you're eating a lot of healthy lentils, nuts, healthy fats, making sure that you're feeling full and satisfied and not trying to do any radical dieting during this time, especially if you're on steroids and already getting like the munchies. But there's no specific supplement that I would recommend for a lupus patient as they go through menopause. But again, there's some really good information out there just on menopause in general and women in middle age, 40s and 50s. Some good experts in aging in general who feel that women don't eat as much protein as they should be. And that actually leads to a little more low energy, low sex drive, some hair, skin, nail issues throughout this time as our hormones are changing because of some concerns about weight gain. So I'm a big fan of encouraging my patients during that time to eat really healthy proteins. And then when we look at the literature for diet and lupus, this would include a lot of plant-based proteins. So I have a couple handouts on diet that I give my patients, regardless of their age, regardless of whether or not menopause is on the horizon. Let's see what else. So maybe we can try one more question here. This is one last question we'll do here. Is hair loss in lupus due to inflammation or due to hormone disruption? Really good question. The answer is probably it's due to many things. So hair loss is a very classic sign of lupus. So it can be due to the lupus itself. There are a few of our drugs that sometimes can exacerbate lupus hair loss, but when we're actually treating the lupus itself, the hair loss should improve. Sometimes having stress itself can cause hair loss, and also having anemia can cause hair loss. So having your rheumatologist address this and making sure that your iron levels are being checked and not having any sort of anemia. If you have low iron from heavy menstruation, so if you're losing a lot of blood loss from a heavy period, that can contribute to hair loss. So making sure that you're talking to your rheumatologist or OB-GYN. If you're saying, hey, my periods seem really, really heavy, can you check me and make sure that I'm not losing too much iron? That can cause hair loss. The lupus itself can cause hair loss, making sure you're not on any medications or having thyroid issues that could also contribute to hair loss. And there are some medications, some shampoos that can be used to combat hair loss. So it can be very multifactorial. It's not always one single issue that is causing hair loss. All right, I think that is pretty much time. I know we could
Great.
probably keep going, but I think that's what I was asked to try to do, about 20 minutes. So I think we're about 20 minutes now.
Yes, we are. Thank you so much for your time, Dr. Wise. We know this is a really complex and personalized topic, and our community has so many questions about this. So we'll be having follow-up sessions to address any questions that weren't covered today. If we didn't get to your question today, on social or via email, just feel free to contact us via direct message or via email at info@lupusla.org, and we'll make sure to get back with you.